Well, good evening, everyone. This is a different subject, sort of, mostly. Um, you've heard different things about what is being cut back and that. And sorry about that. Uh, so, what they're saving and what they're putting out, and they got fact checked. Okay. So I'm going to run the gentleman from Midas Touch. Like I told you guys, they are ex-lawyers and all that. Hi, Paula. Um, hey, baby girl. And you know how they said they weren't going to touch the Social Security and all that. Well, I can't explain it at all. I mean, I just, too much to know. Sorry, I have a problem with my right eye tonight. So I'm going to explain. The gentleman I am going to put up is from Midas Touch. And believe me, he's telling the truth. And I'm adding him to the stage. Make him full screen. And here we go. And I'm going to play him. This is Michael Popak.
Deportation charge, putting people in prisons and in raiding churches and schools. Somehow they think there's going to be a savings of what they listed originally as $8 billion with a B dollars. Turns out somebody fat fingered it. It was really 8 million. Just a typo among friends. So that was ICE. Now let's go to U.S. aid. That arm of diplomacy that we automatically overnight turned off the spigot to, putting hundreds of millions of people into despair and in a very inhumane way, cutting off aid to people in foreign countries. Again, an arm of our diplomacy. That was listed at
arm of diplomacy. Something that our president don't have.
$655 million, 3 separate times for close to $2 billion. Now it's listed at 18 million. That's a big difference. Social Security, right? Everybody wants to talk about Social Security cuts, and they listed them on the wall of receipts at $232 million. Sounds like quite a hefty cut. Turns out it's really only $560,000 because he killed a software contract about gender identity. So 232 million, 560,000, 655 million 3 times, really 18 million total, and ICE 8 billion down to 8 million. When you do all of that, one last one, Treasury Department, they listed it on the wall of receipts, taking responsibility for it at $1.9 billion in savings. Sounds pretty hefty. Yeah, except it happened during the Biden administration, had nothing to do with Elon Musk. So when you take off all of these numbers, the amount of quote unquote savings plummets from 65 billion to, like 9 billion. And even that I think is fudged. Why is it important? Because this administration, led by felon in chief, liar in chief, somebody who is a dissembler, who won't look what's the old joke? How do you know when President Trump is lying? His lips are moving when he talks. You can't trust them at all. And they use these fake facts, this false narrative, these forged numbers to justify their existence and to justify policy. We need to do X because Y happened, but Y didn't really happen at all. It's a phony Y. And therefore, we are misled to believe that these things are necessary to occur because something bad has happened. They found fraud. They found waste. They were sending condoms to Gaza. All of the lies. Hollywood stars are going on aid tours on our expense. Luxury hotels in New York are being used for the migrant crisis. All of it phony. All of it false. But the Trump administration knows no boundaries when it comes to fake information and lying. There's no other way to put it. And then right on cue, Carolyn Levitt, the world's youngest.
Okay, there we go. And I don't want him. Okay, stop sharing screen on there. Oh, shoot. There we go. Oh, wrong camera. That's not what I really wanted to show you, but that was about the savings on the Social Security and information. Okay, here's what I've been watching this channel. His name's Dr. Let me get that one off so I don't get it. Okay, here we go. His name's Dr. Ed Weir, W-E-I-R. Okay. Let me get this presented. Now, he explains everything because he used to work for Social Security. Okay. Him and his son set up this podcast. Oh, wait a minute. No, ain't what I wanted to do. Okay. I know what I didn't do. No, I did get it down there. Okay. So all I want you to do is listen. And if you come find something that's interesting, please go visit his website. I did put it up there in the messenger, but I also put, if anybody wanted to come up and talk about the subjects, the StreamYard links in there too. Okay, here we go. And this is Truth Behind, wait a minute, sorry. Truth Behind Free Medicare Part A, B, and C, D. Live questions and former insider. Okay, so that's the title of this one.
A lot of stuff going out there on the internet about it being free or zero premium. We're here to tell you that obviously with everything in life, nothing is free, but you just might be able to get some Medicare health benefits for zero for your particular case. So we're going to talk about all that in terms of Part A, Part B, Part C, Part D, the prescription drug plan, Medicaid, Medicare, and we're going to help you navigate the bureaucracy. And I am super happy to let you know that Ari from Chapter, everybody know that regular viewers know that Chapter is the organization and group that I've reached out to or partner with when I retired from the Social Security Administration. If you're new to my channel, my name is Ed Weir. I ran the 3rd business Social Security office in the country in my semi-retirement. After about a week of retirement, here I am helping you all navigate the bureaucracy, all things retirement, disability, survivor benefits, auxiliary benefits, child benefits, Medicare Part A and Part B. But the Part C, the Medicare Advantage, the Medicare supplement plans, the Part D prescription drug plans, you get those through private companies. And there were just too many people getting the wrong plans at the wrong time and not being told the correct information. So I kind of broke down and said, okay, we need to find someone, someplace. My son and I looked through the entire country and we found an awesome company that is going to help you navigate all of that, and that is Chapter. And I'm so happy that Ari is joining us today and help us navigate the bureaucracy and talk about all things. So how you doing, Ari?
I'm doing great, Dr. Ed. Thank you so much for having me on your channel. I'm delighted to be here with your viewers.
And I understand you've got a little bit of experience in Medicare.
Just a little. Help thousands of people sign up for Medicare and then find the single best fitting plan for their needs. And
Yeah.
the framework that our team uses here is based on your viewers' 3 Ps. So your viewers' 3 Ps, they won't all be the same. The first P are your viewers' providers, who are the doctors that they want to see. We need to make sure that each of them is in network or accepts original Medicare. The second P is your viewers' prescriptions. What medications do they take, brand name or generic? What pharmacy do they like to go to? And then the third P are your viewers' priorities. What's important to them? Do they love to travel? Do they have a second home somewhere? Do their grandchildren live out of state? All of that factors into finding the single best fitting plan for your viewers. And there's actually 24,000 plans nationwide. So that's really important for your audience to keep in mind. They should work with an independent, unbiased advisory that has access to all 24,000 plans.
Perfect. Yeah, that's we're going to start the live Q&A. We've already got tons of questions. So we'll go through today's agenda, today's topic as quickly as possible so we can get to individual questions. And that's what I tell people when they ask, when should I start my retirement benefits? Should I start Survivor first, or benefits on my own record? It is 100% individualized. Nobody can tell you you should start your benefits at 67 or 62 or 65. And the same thing with a Medicare plan. Nobody should tell you that the best thing is for you as a Medicare supplement plan G or a plan N or a Medicare Advantage.
Okay, up here in the corner, there's free Medicare help for you to call. It's a chapter they started. This is where they can answer your questions and that. I still haven't called. I've been very lazy. Okay.
It really depends on the questions, the answers to the questions. How's your budget? Where do you live? How healthy are you? What type, what are you looking for? So people, often pick their Medicare plans or when they want to retire by, oh, my next door neighbor did this. Yeah,
you probably don't see the same doctors as your next door neighbor.
Exactly. So yeah, so we want to make sure everybody gets the best thing, because so today's topic is about so-called free, and the Center for Medicare and Medicaid Services is very, very strict on agents. Unfortunately, a lot of agents kind of go off in the wrong ways, and they give incorrect information. And I always give the example of when you walk into one of those big stores and you see someone that has a Medicare table there, and it says, "Ask me about Medicare," and salespeople out there says these are terrible salespeople. They should they should stand up and say hi to people and shake hands and stuff like that. They can't do that. The Center for Medicare and Medicaid Services, which Dr. Oz perhaps might be the new boss of, but they're not allowed to do that until you actually ask them, hey, tell me about Medicare. Then they'll jump up and say, hey, talk about Medicare. Same thing with the people out there calling and cold calling. That is October 1st. It was supposed to change. Have you seen a change since October 1st? They're not supposed to be cold calling you anymore?
That's correct. You are not supposed to be cold called unless you give permission to be contacted.
But it's not necessarily happening like that, is it?
Unfortunately not.
Yeah, unfortunately not.
Lots of stories of people being called repeatedly when they're on the do not call list and haven't given permission to be contacted.
Exactly. So yeah, we really need to make sure this stopped. That's one of the reasons my son and I chose Chapter, is because if you don't call Chapter, they ain't gonna call you. People all the time send me an email that says, yeah, okay, yeah, thanks for answering my retirement question, and can you go ahead, Chapter, give me a call? And I'm like, nope, sorry, can't do it. Yeah, no, you have to call them. Until you call them, they ain't gonna call you. So that's another
Dr.
reason.
Ed can't give us permission on your behalf. You have to get permission.
Exactly. Even brothers and sisters and mothers and stuff. Oh yeah, call my daughter. You're technically not supposed to do it, and Chapter doesn't do it. But unfortunately, there's a lot of people out there that just don't do it right. Okay, but all right. So let's get with Part A. So Part A of Medicare is hospital.
Wow.
So it is zero premium for most people. There's a very, very small percentage of people that pay Medicare Part A premium because they're just not insured. They didn't pay into Social Security, Medicare for long enough. But most people, 99% of people, it's zero premium. And people say, well, that sounds like free to me. Well, actually, it's not. because there's this thing called FICA taxes that you paid for decades. You know, when you pay FICA taxes, you pay, it's two parts. It's Social Security, the 6.2%, and then it's Medicare, 1.45%. So you paid that for decades and decades and decades. And when you turn 65, or if you become disabled, then guess what? You prepaid for it. It's like those, do they have those anymore? The prepaid lawyers or something like that, where you pay them a whole bunch of money and then in the future, not sure if they have those anymore, but it's kind of like that type of system, right?
Well, in terms of paying, how Medicare Part A is paid for, it's paid for through the Hospital Insurance Trust Fund, which, as you mentioned, people pay into through their federal payroll taxes. And so if you or your spouse has paid for 10 or for 40 quarters, which equates to 10 years, then you receive premium-free Part A. And it's only one of you or your spouse that has to pay in. It doesn't have to be both of you.
Yeah, a lot of people miss that as well. Even on retirement benefits and everything, they say, well, I can't collect retirement benefits, or I can't collect Medicare because I never paid into the system. But were you married to someone? Are you currently married to someone? Were you married to someone for 10 years or more that paid into the system? You can get Medicare based on their record. You can get monthly benefits based on their record. So unfortunately, there's a lot of people out there. And it's looks like it's going to get worse too when they're talking about cutting back Social Security staff. It's already at a 50-year low. So I guess they're looking to put the same number of staff there was back in 1935 into the Social Security offices. So a lot of people, unfortunately, are going to miss benefits unless they subscribe to this channel and come and answer questions.
And can I add one point there, Dr. Ed? If you're older than 65 and you haven't paid in to the Hospital Insurance Trust Fund, that is, you on your record, you don't have 40 quarters or more of paying federal payroll tax. If your spouse has turned 62 and does have enough work credits, then you can qualify off your spouse's work history once they turn 62.
Perfect. Yes. Perfect. Okay. So, so Part A, it's zero premium, but technically not free. You just prepaid for it. Part B is definitely not free, but there is ways to get it zero premium. So Medicare Part B is $185, and everybody pays the Medicare Part B premium, unless they are getting other people to pay for their Part B premium. And how else can you get someone to pay your Part B premium?
You can qualify for Medicaid. So if you are low income and it's set by, if it's through the Medicare Savings Program, if you qualify for the Medicare Savings Program, then you qualify for some level of Medicaid assistance, and your Part B premium will be covered through the Medicaid agency. And that varies state by state. Some states have more generous limits than the federal poverty threshold for Medicaid.
Yeah, so you apply through that, go through the state programs, apply
Right.
low income, low resources. If people that on Medicare 65 or older or on disability for 24 months, if you're having a hard time paying for that $185, please go to Medicaid, your Department of Social Services, Department of Welfare, apply for Medicaid. And if you're approved, they'll pay your $185.
Yeah, that's absolutely right. Here in Arizona, it's called Access. In Alaska, it's called Denali Care. But as Dr. Ed mentioned, you want to go to your state Medicaid agency and apply for Medicaid if you believe you qualify. And you have to be below the income limits that your state sets.
Perfect. So let's go through some questions here. In 2022, Medicare Part B premiums rose by 14.5%, one of the largest annual increases ever seen in the program's history, because we were all paying for a new Alzheimer's drug. But it turns out that that's one of the reasons it went up so high. But then it turned out that I guess not as many people took the drug, or not as many, or it didn't turn out to be as expensive. That's why the next year they didn't increase it as high, right?
Yeah, that's correct. So that was a very large increase that this question is referencing. And then there was a moderate increase in 2023 and in 2024, getting us to this year's Part B premium, which is $185 per
Okay.
month.
Yeah, you're right. The porthole. That's why he's saying to go over to the Medicare, Medicaid, and go through that part. And contact your representatives for your state, and that they can help you get you the information where and how to do this.
Perfect. Someone asked, are they going after Medicaid? Well, Medicaid has always been kind of on the, kind of the target list for a long time. And the reason it's still around is because we participatory democracy. We reach out to our politicians and say, hey, before you think about doing this, I'm just kind of giving you a heads up. Maybe you should rethink it. So yeah, if on anything, if you believe that cut shouldn't happen in the future, reach out to your politicians. And yes, absolutely. Okay, so let's get back. And so Part C, which I'm not a big fan of it being called Part C, but those are the Medicare Advantage, the private Medicare Advantage plans. The reason I'm not big on this call, because it sounds like it's part of original Medicare, that it's government, but Part C is private companies. And a lot of those are zero premium. So what is the difference between Medicare Advantage and the Medicare supplements? There are premiums for Medicare supplements, correct?
Correct. And regardless of whether you choose Medicare supplement or Medicare Advantage, you can only choose one or the other. But you definitely want to have one or the other, because either one is going to be better than original Medicare. Because under original Medicare, which is Part A and Part B, and that comes directly from the federal government, and it's printed on your red, white, and blue card, you still owe 20% out of pocket for all your medical costs. So let's use the example of my mom. My mom lives in the Chicagoland area, and last summer she received a knee replacement, which is a $50,000 procedure. My mom would have owed $10,000 for her knee had she not had some type of additional coverage. The very next month she broke her elbow, she would have owed 20% for everything related to her elbow had she just had original Medicare. Now, with Medicare supplement or Medicare Advantage, it sets a maximum out of pocket on the amount that you can owe for your hospital and medical expenses. And that is huge, because under original Medicare, there's no maximum out-of-pocket protection. That 20% can just keep going up and up. For my mom, it would have been tens of thousands of dollars last year. So Medicare supplement sits on top of original Medicare and covers the additional costs that you would otherwise have. It covers that 20% gap that you would otherwise owe. What people really like about Medicare supplement is that it's very comprehensive. It's networkless. You can see any doctor or go to any institution that accepts original Medicare. Now, there's a premium for that, though. You pay for it, as Dr. Ed mentioned. Then there's option 2. Option 2 is Medicare Advantage. Medicare Advantage is administered by a private insurance company. It's a replacement for original Medicare, and it goes by other synonyms. You might have heard of it as Part C, or an all-in-one plan. So this is a replacement for original Medicare administered by a private insurance company, and that private insurance company is on the hook for administering your hospital and medical benefits. And 65% of Medicare Advantage plans don't have a premium. So most Medicare Advantage plans have a $0 premium, but you still owe the Part B premium of $185 per month to Uncle Sam unless you qualify for Medicaid.
So whether you have a Medicare Advantage or a Medicare supplement plan, you still have to pay the Part B $185 unless you're having some other organization pay for it for you.
Correct.
Okay. Let's see, a quick question here. What do you think of the high deductible G? So those are the Medicare supplement plans with a high deductible. Usually the monthly premium on those are quite a bit cheaper. What do you think about those, Ari?
Yeah, so this question is asking about Medicare supplement, which is also known as Medigap. Many people in your audience have selected a standard Medicare supplement plan. And each Medicare supplement plan letter type is standardized under federal law. That is, the insurance company must cover the same hospital and medical benefits. So for a standard Medicare supplement plan, you owe the premium, But for the most comprehensive plan letter type, which is plan letter G for someone who's recently turned 65, your maximum out of pocket for this year would match the Part B deductible, which is $257 for 2025. So what a high deductible plan G does is you still owe a premium, but it's a lot less than the standard plan G premium. However, you have a deductible that you have to hit first. And rather than $257, it's close to $3,000 for this year. So you owe the first approximately $3,000 out of pocket, plus the premium for your high deductible plan G, plus the Part B premium of $185. And so you have to do the math on how much healthcare you utilize. And then you have to compare that to what you might be able to receive from a Medicare Advantage plan, because you want to look at the maximum out of pocket for the Medicare Advantage plan and make sure that you're getting a good deal for that high deductible plan G.
Yeah, I always tell everybody, if they had a crystal ball and they know exactly how healthy they're going to be for the next 50 years and whether they're not going to get injured or someone is going to, sideswipe them in a, intersection or whatever the case may be, if you've got that crystal ball and it works 100% of the time, then I would definitely get a Medicare Advantage with a zero premium, because why waste money on something that you're not going to need for the next 50 years? But if something happens, Medicare Supplement Plan G, that way, if something happens 5 years, 10 years from now, you got $1 million, therapy or something, you pay what, $257, and then you're pretty much done.
That's right. So for my mom's knee replacement and for her elbow fracture, her maximum out of pocket for last year was $240, because that was the Part B deductible last year. If she has another really bad year.
Okay. I keep getting confused on Advantage supplement and the other one. It's like, which one do I really need? I don't understand that,
Her maximum out of pocket would be $257 for this year, because she's on Medigap plan letter G, standard plan letter G.
Perfect. So so it really depends. And unfortunately, a lot of people are like, yeah, I'd really like to get that, but I just can't afford the monthly premium. So last night I think I was thinking about 51% of people get a Medicare Advantage plan. And the reason they do is, budget issues, or they're just not told there's other options, like a high deductible G. Is there a high deductible N or a high deductible F?
There is a high deductible F. So someone would have needed to have started Medicare before 2020 in order to qualify for a high deductible plan letter F. For someone who recently turned 65, then their option would be standard plan G, high deductible plan G, or as you mentioned, Medigap plan letter N. And we can unpack these differences. I know to a lot of your viewers, you've recommended Medigap plan letter N, which is also an excellent choice. And it's just different than plan letter G in a few respects.
I'm just cheap like that. So N usually has a lower premium, and it looks as though, from what I've seen, and it sounds like pretty much everybody agrees, that the premium increases over the next many years should be less under plan N. And so just I'm cheap. But if I was, other than having, hair loss, which unfortunately Medicare won't cover.
Not covered.
We need to work on that. People, call your politicians today. Male pattern baldness is an important thing.
It has to be medical necessity. That's the standard for having it covered.
Yes. If G is definitely easier to understand versus the NN, but either one of those is perfect. And I always recommend checking out those first. And then if it just doesn't work for you because of your particular situation, your budget, or whatever the case may be, then you check out Medicare Advantage. But as Ari says, the 3 Ps, check your providers and your needs and all that stuff. I want to interrupt here and answer a question. It looks like Social Security gave out some wrong information, so I want to make sure I correct this. This is going to happen more and more because of the staffing, and the good people that work with Social Security are going to start bailing, and unfortunately, it's going to be tough. So here, Paula asks, I'm collecting the survivor benefits. My full retirement age for survivor benefits is this September. Someone at Social Security told me I'm capped at 23,400 for the entire year. No, the year you turn your full retirement age, whether it's retirement benefits or spouse benefits or surviving spouse benefits, whatever the case may be, the year you turn your full retirement age, the annual earnings limit changes. Last year, it was, basically 20, it was actually a little bit less, 22,000 or so last year. But this year, because you're your full retirement age, you're allowed to make $62,160 up until, would you say September? Yeah. So from January to August, as long as you're under $62,160, you're good. If you're over that, then Social Security holds back $1 for every $3 you go over. So I want to make sure I get that correct, correct information out there. But one of the things that a lot of people miss, including Social Security employees, not anybody in my office, because we did a lot of training, that's also going to hurt because, when you're just basically, the offices are just basically able to tread water, they're not going to have a lot of time for training on new policies and stuff like that. So unfortunately, there's going to be more misinformation. Yeah, the dominoes are going to be falling. But in survivor benefits, there's a different full retirement age. It's a few months different than a regular full retirement age. But in terms of the annual earnings limit, the full retirement age is exactly the same as regular retirement age. So it's a little bit different. But in your case, you're $62,160, you're good up until that amount. So I just want to correct that. Another way to save money on your Medicare is Part B give back. What are those, and why are so many of them called Patriot and Honor plans?
Well, some Medicare Advantage plans have a Part B give back. It's going to depend on the zip code that you live in, whether that type of benefit is offered as part of the Medicare Advantage plans in your zip. And that varies zip code by zip code across the United States. In many zip codes, there isn't a plan that offers a Part B give back. With that said, if your viewer lives in a zip code that does offer one, then that will contribute towards your Part B premium. And so the plan will have some reduction in your Part B amount. So it'll reduce that $185 based on the amount of give back that the plan offers. To the second part of your question, you asked, why does it include honors, or what was the other term you used for it, Dr.?
Patriot.
Patriot.
Yes.
Okay, so those are specific plans that typically are offered to veterans, because a veteran is choosing that type of coverage since they get their medications through the VA, and then they're using the Medicare Advantage plan, which does not have a prescription benefit. So this is a certain subset of Medicare Advantage plans that don't have a prescription benefit, unlike most Medicare Advantage plans, which do cover your prescriptions. So that would be a plan that is targeted towards someone who gets their medications through the VA. So unless you're a veteran, that really isn't the plan for you, because you likely need prescription coverage. Otherwise, you're going to face a lifetime late enrollment penalty.
Yeah, I always tell people that, being an old Marine Corps veteran, I always try to take care of vets as much as possible. But yeah, a lot say, well, why do I have to pay the $185? I don't use, Medicare. I use the VA clinic down the street, and so I'm happy. And I said, well, you might be able to have your cake and eat it too. You keep the VA, but it's a good thing to maybe have a fallback in case, that we see the VA getting cuts. Maybe you decide to move, maybe you want a second opinion. And if you don't have Medicare Part A and Part B, then you're kind of stuck with whatever the VA has. So, but they just don't, there's like, well, the $185, that's the straw there, that I just can't pay that. So I say, okay, well, check to see if there's a Medicare Part B give back in your particular area that pays $50, $100, $185. And so you can have, your cake and eat it too, right?
And we want to distinguish these plans from TRICARE for Life. TRICARE for Life is for retired service members who served the country for 20 years or more. And they and their spouse receive a free Medicare supplement plan from the Department of Defense. And so we wouldn't want to do anything if you have TRICARE for Life, because you definitely want to get that free Medicare supplement plan from the DoD.
Right. Yeah, and there's a lot of Medicare insurance agents and brokers out there that sign people up for plans that have TRICARE. And what is Chapter's philosophy on that?
That's a big no-no. No way should a Medicare Advantage plan be sold to someone who is a retired service member and is eligible for TRICARE for life. Full stop.
Yeah, and definitely not a Medicare supplement plan.
No way.
Yeah.
Why would they pay for what they're receiving by virtue of their service to our country?
All right. Perfect. I like it. Good deal. All right. But yeah, so we're not talking about, so the TRICARE for life are the people that actually retired or went out on a disability or something. But I was only in the Marine Corps for 8 years, which is 20 years in all other services. But anyway, I was only in it for 8 years. So I wouldn't qualify for TRICARE for life. I would possibly qualify for VA medical. So yeah, that is the difference out there. Let's see here. Let me just get to a question. I mistyped my questions yesterday. Hey, Dark. Oh, okay. I remember you. Called Medicare about Plan N and G. 2 different answers. Yeah. No, I'm not eligible till 65. And yes, but premiums would be higher, which is correct. So trying to get a Medicare supplement plan under the age of 65, kind of difficult, isn't it?
Yes, it's going to vary based on the state that you live in. Many states do offer a Medicare supplement plan for those who are younger than 65, but you're going to pay through the nose for it. So the question would be whether the premium for that plan would beat what you could receive from a Medicare Advantage plan based on that Medicare Advantage plan's maximum out of pocket, and whether that Medicare Advantage plan would work for you. So this is definitely the type of question that you would want to speak to an advisor with one-on-one, because it's really going to depend on your 3 Ps and what you can afford.
But when he or she turns 65, all bets are off, right? It's free game, right?
That's right. The good news is that when this person who is currently on Medicare, so this person received Medicare younger than 65 by virtue of receiving cash disability benefits for 24 months or more. So when this person turns 65, they're going to receive an initial enrollment period 2. And that is your opportunity to choose a standard Medicare supplement plan offering, and you can't be discriminated against by the insurance company that you select. They can't charge you a higher price, and they can't deny you due to pre-existing conditions.
Perfect. Yeah. So I tell people on disability, there's certain times you need to kind of focus a little bit. And when you're 60, if you're on disability, see if you're entitled to any survivor benefits, because you can get benefits on top of your disability benefits. One offsets the other. But a lot of people, they say, well, I don't want to get the extra money because then my disability will stop. And if my disability stops, then my Medicare. And if I don't have Medicare, then I'm out. That is not the fact. You can have disability and survivor benefits on top of it. When you turn 62, check to see if you're entitled to any spouse benefits, divorce spouse benefits, independently entitled divorce spouse benefits. When you're 65, check to see if a Medicare supplement plan is, right for you instead of a Medicare Advantage, which probably in most states, that's all you can get. And then once you turn your full retirement age, 66 and 8 months or 67, guess what? You're no longer technically on disability. Your disability benefits switch over to regular retirement benefits, and no more work limitations, no more continuing disability reviews. You are now free. So, question here. Oh, international question. Hey, Sergeant, I'll be splitting time between Thailand and France. Wow, that's interesting. Both of which have so much better medical coverage for so much less. Yeah, there's a lot of people that actually go to Thailand. They have, it's called medical tourism. People in the United
Yes.
States, yeah, that's a big thing going to India and Thailand. People say, well, I don't want to go there. Go to, some doctor I don't know. A lot of those doctors actually studied in the United States, went, resident at Johns Hopkins or UCLA, and then they went back and opened up a clinic over there and get, 10 cents on the dollar for whatever you need. But so coverage so much less. Should I get an Advantage plan to hedge my bets? What do you say, Ari?
So Todd's circumstance is pretty unique. I imagine Todd is paying the Part B premium of $185 per month. So that way, if they decided to move back to the United States, they wouldn't owe a late enrollment penalty for Medicare Part B. And so Todd is asking, since I'm paying $185 per month for Medicare Part B, do I need a Medicare Advantage plan?
I don't know,
And
Kayla.
Todd, it might be a great way to also get your drug benefit covered, because that's what people really like about Medicare Advantage plans. It's all in one coverage. Many of the plans include prescriptions as well. And so the answer is it depends, and it's going to be based on your 3Ps and also what type of care you like to receive when you're back in the United States from Thailand and France.
Okay, perfect. Zippy says, I'm not sure. Chapter got the best insurance. Can I call again to bubble check? I guess double check. And it says, yeah, that's spell check. I always love those. You're not an insurance company per se. You guys are advisors, brokers that connect everybody with all of the plans in their area, correct?
Correct. We are the only independent, unbiased advisory, in my opinion, and that's because we have a database of every insurance company and every plan that you can possibly purchase in your zip code. And then we sort those plans based on your 3Ps, the doctors you see, the drugs that you take, and what's important to you. And of course, you can go to Medicare.gov, or you can call the number that Dr. Ed has, and we'd love to connect and see if we can help you.
Perfect. Yeah, that's one of the reasons my son and I, look for a place to help people out. And the cold calling is like, you got to stop harassing people. Like someone says, Ray says, 5 years away from Medicare, and I get multiple calls a day asking me if I'm on Medicare. So yeah, they really need to stop that. And that's one of the reasons I chose Chapter. You don't call them, they don't call you. Another reason is the member success team. A lot of independent agents. I tell people, if you've got a brother or a nephew or a niece that's a Medicare insurance agent, you got to go with them. Come on, it's family. You're not going to Thanksgiving if you trust them, if you're whatever. But usually you got to go with them. But the problem I see with the independent, a lot of the other insurance, the Medicare insurance agencies, is they sign you up and then they forget about you. So that's another reason we chose Chapter, is because when you sign up, it's just kind of the beginning of the journey. So if you lost your doctor, or if you get some type of weird bill, and you just call Chapter and the member success team, and they help you navigate all of it. What other kind of stuff do y'all help with?
Well, we handle any hiccups that come along with using your insurance. So whether it's trouble having a prescription filled and seeing if perhaps a prior authorization is needed, or whether you're having a challenge with seeing a specialist or getting a doctor visit approved, those are exactly the types of questions that our member success team handles. And so people who work with Chapter are supported by two teams, their advisor and the member success team, which handles anything post-enrollment, that any challenges or anything that you're interested in looking at about your insurance.
Perfect. All right. So something looks like Jose. Oh, I think Jose, I had a question a couple days ago. I made an appointment with Chapter for Saturday at 12 a.m. with B. Osborne. Awesome. Thank you. And the other kind of deciding one is the old Henry Ford. I think it's the quote is given to several different people, but whether it was phones or Henry Ford, you can have any color of car you want as long as it's black. So if you call a company that only represents XYZ health, Medicare insurance, then guess what plan they're going to recommend? You can have, we'll give you anyone as long as it's ours. So that's the difference between kind of an agent and a broker. Captive agents work for that particular company, that insurance company, and brokers work for you. So they lay out, they ask you all the questions, the 3Ps, and then they say, well, based on all your information, this is, this 1, 2, 3, 4. These are probably the best ones for you. And they let you know all the details, right?
That's absolutely right. You want to make sure that you ask a broker some questions, though, when you're doing your research. And the first question is, how many insurance companies do they represent? To your point, if you go to a Ford dealership in the 1920s, guess what you're walking off the lot with? A black Model T. So how many insurance companies do you represent? How do you search across all of those insurance companies. How do you know whether my doctors and drugs are covered by your particular recommendation? And so on and so forth. Those are exactly the types of questions I would be asking if you're thinking about working with, as you mentioned, a friend or family member who's a broker.
And kind of the cherry on the whole Sunday was, I I think Chapter is the only one that does it. I haven't seen or talked to anybody else that does it. So if there's 50 plans in a particular area, but in your particular plan out in the middle of the desert, out in the country, there is one local plan that just, is put together by a bunch of doctors in that particular area, and it's only available in that area. And Chapter just doesn't have to be, Chapter is not, was it licensed or contracted to sign people up for that particular plan? What do y'all do? Just don't tell them about it?
That's the plan we're going to recommend, because we are always going to recommend the single best fitting plan for someone, regardless of whether Chapter is appointed with the insurance company or not.
There we go. That's the cherry right there. That's the thing that said, okay, we're done. We've went through hundreds of different health insurance organizations, and that's the one that got it. Because there
Can
are
I
a
say
lot of
one more thing here?
Sure, absolutely.
Our advisors are blinded as to which plans Chapter earns revenue from and which ones we don't. The only thing that matters to the Chapter Medicare advisor you work with is making the single best fitting plan based on your 3 Ps.
Okay, so basically, when they're recommending, so if that particular doctor's network in country desert is the best plan, they'll say, well, this is the best plan. Let's go ahead and get you all set up. And the advisors did it, Chapter might not make any money on it, but they'll still recommend it.
Correct.
Perfect.
That's part of that's core to our mission.
Good deal.
That's exactly why we started Chapter in the first place.
All right, good deal. All right. Let's see. Let's go back to Part D, the prescription drug plan. That's the prescription drug is the reason 2025, I think, was probably the most chaotic Medicare season. This last season was the most chaotic Medicare season we've had in decades. And so many people's plans, I think what the last I saw is about 1.8 million plans were canceled. And a lot of the ones that weren't canceled, the services and the benefits were downgraded. What happened there? What was all that about?
Yeah, to your point, so you're referring specifically to some Medicare Advantage changes that happened in the fall, and those plans might have gone into effect as of January 1st if, unfortunately, one of your viewers got placed on a plan where they experienced in January, let's say last month, they went to their doctor and they said, oh, we're out of network now with the plan that you had last year. So what that person can do is use the Medicare Advantage open enrollment period to get another shot to review their Medicare Advantage coverage. So if you've experienced something suboptimal about your Medicare Advantage plan over the last 7 or 8 weeks, now is your time in order to get that coverage adjusted. And you need to do it before March 31st, because that's the end of the Medicare Advantage open enrollment period.
So if you forgot to check your plan during the annual enrollment period, was it October 15th to December 7th? Now you still have time up until March 31st. If you call Chapter now, hopefully they find you a better plan. If not, they'll say, hey, you're in the best plan. But if they find you a better plan, they can sign you up today, and your new plan will start March 1st. That, gets the extra benefits or now covers your doctor, right? It takes place almost immediately.
Right. It would start the first of the following month. So if someone did it today or tomorrow, their plan could begin March 1st.
Perfect. And then, so also for Part D, there's also the extra help with Medicare prescription drugs. That's a program that's actually administered by the Social Security Administration. And that's probably one of the easiest applications to do. I've taken probably millions of those. And they're really, really easy, but it is income related, low income, and you just might be able to get extra help. Over a few years ago, they estimated people get about $5,600, $5,800 in extra benefits, extra help based on that. It's probably going to be a little bit less this year because now there's a cap on drugs, right?
Right. There is a cap on Part D that went into effect on January 1st. And the maximum out of pocket on Medicare Part D is now $2,000 for this year.
Yep. See, Airsoft Family Montage asked about what are the dollar caps for an advantage plans for prescription. So yeah, 2,000. Yep. So what do you, a lot of people, try to save, do everything they possibly can to save money, and particularly in this economy. So they say, well, I can go ahead and go through my prescription drug plan or my advantage plan and get my prescription, and it's going to cost me X amount of money. Or I can go online, like what Mark Cuban or, some of these other ones out there and get it there. Is there an issue with that? Do you notice anything that one might hurt the other?
So if you go outside of Medicare Part D in order to get a prescription covered, then it won't count towards the maximum out of pocket. It's totally fine to do that. And it can be cost effective in order to price shop your medication. And you might be surprised on what you could save if you get it outside of Medicare Part D, but you should just be aware that it won't count towards the Part D out-of-pocket maximum then.
So basically, if that's only the one medication they have, then it's probably not an issue. But
Okay, I'm going to stop it right there because I'm coming up on an hour, and I don't want to go too long. I'm going to feature this guy for a while because no matter what, we know someone that's in the nursing home. We know someone that's old enough. And like I said, I came across this guy, and I feel that it is best for us to let people know to go and check this channel out. I know you don't want to come to my channel. That's fine. But just think I'm looking out for you too. So I want to go ahead and say good night. Thank you for coming in, Paula and Kayla. I appreciate it. And for those who are in the back, thank you very much. Please at least share it out to other people so they can get this information. Now, this is just the beginning of part of this series. Let me see. Here I'm going to give you the next one that comes in next. And one second, my eyes are getting let me see. Okay, here's the next one. Former insider protects your checks. Plus live question, blah, 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 blah. That is his next one. The one after that. Okay, that's not coming down. Okay, let's see. Where am I? I'm losing it. Yes, he does have very, very good information. But go check out his channel. Like I said, it's very important. No matter what, this has nothing to do with the ability of Trump too. But it is, but it isn't. Just for everyone who don't understand. I mean, I don't understand. I'm one of those. I've been with my same insurance company, my car insurance, for over 40 years. Over 40 years. I don't like change. Same with my health insurance. I don't like change. If I figured out I can get this and this, and that's fine with me. What amount? Okay, I'm paying. Just like you pay electric bill or, a bill. But, okay, yeah, have other people promote this channel. I mean, his channel, someone needs it, the information. Okay, much love. Much love and respect, and I hope you all have a blessed, blessed day. Bye, everyone.